Hello, everybody, and a big thank you to everyone who joined us this evening for a webinar that we wanted to share on social prescribing and focusing on mental health and, of course, young people with cancer. We have some lovely speakers and contributors today. I'm very pleased to have with us Dr. Saintuya Dashdondog. I'm also very pleased to have Bradley with us from our own Youth Cancer Europe community and Dr. Ruxandra Simonescu from the Babesvai University. Everyone will have very interesting contributions and information to share with us. So let's start and let's dig in. If anyone has any questions, please let us know in the chat. If you feel like introducing yourself, you're very welcome to do that as well. My name is Rizvi. I'm one of the founders and the executive director of Youth Cancer Europe. And Youth Cancer Europe is a participant in the MELODIC project that we will speak about today. Youth Cancer Europe is an organization made up of young people under the age of 40 with lived cancer experience. We have participants from more than 40 European countries, participate in many European projects, coordinating the YARN project. I know that many of you here as audience on this webinar are also connected to the YARN project, and we thank you so much for joining us. And Youth Cancer Europe is really focusing on youth, changing policies, changing regulations, changing practices, and changing the future of young people with lived cancer experience. So why is today's conversation so important? For those of you who don't know much about social prescribing and what it means, we will talk about it, we will speak about definitions, and we will speak about how we approach it in this project that we will share with you today. But the underlying importance and the reason why we focus on this very specific approach is because it is addressing a very important problem and challenge that young people with cancer face. Mental health, social isolation, loneliness, uncertainty, a break in education, uncertainty about futures, careers are very important anxiety-provoking side effects of a cancer diagnosis. So the reason we focus on this topic in MELODIC, which you are very welcome to read about more by scanning in this QR code and listening to the rest of this webinar today, is because this project is focusing on mental health for this very specific age bracket, focusing on young people between the ages of 18 and 35, including on their families and on their caregivers. This project pays particular attention for the first 2 years after cancer diagnosis. It's aimed at improving screening and early identification of mental health needs, very specifically. It will develop and test targeted person-centered interventions and will build evidence-based input from young people and will build on evidence-based input from young people, caregivers, and healthcare professionals as well. So, why social prescribing? I know that this is a terminology or a concept that's new to many of us. Well, we will be talking about it because many factors affecting well-being cannot be treated through medicine alone. The method or the approach of social prescribing really focuses on the words we also emphasize on the poster: community, connection, and care. It connects people with non-clinical support in their own communities, in their own neighborhoods. It usually involves referral pathways through healthcare professionals or link workers, and we will talk about link workers and who they are in the clinical setting, in the medical setting, just a little bit later on today. It can include peer support, for example, arts, creativity, movement, exercise. It can also include nature-based activities, practical support, or social support. And it focuses on quality of life alongside clinical care. So there are a few papers we would love you to look up if you have the time, if you are curious. For example, this article that was published just recently in 2025, it talks about potential psychosocial and quality of life benefits in cancer populations. So this is a very specific paper, very specific, talking about people with cancer. It's a feasibility study. It talks about reduced loneliness and isolation. In its reported outcomes, it talks about improved emotional well-being, increased confidence and participation, improved quality of life, reduced fatigue and distress. And we'll be talking about these more later on. And here is another paper, which is a systematic scoping review. So what does the evidence show? Evidence show reported outcomes, as we said, on psychological well-being, for example, reduced depression, distress, reduced anxiety. It talks about fatigue and functioning, and here it reports reduced fatigue-related distress, improved activity, participation, social outcomes such as reduced isolation, stronger social connections, and we will be talking very specifically about what social connections mean and how we can study social connections later on today in this webinar with a presentation from another project. Obviously, it looks at quality of life, improved emotional and functional well-being, or behavioral outcomes, for example, increased participation in community activities. You're very welcome to look up these publications. So we also wanted to look at what kind of interventions are being studied so far in the literature that we have found. We have found labels such as green prescribing, blue prescribing. So what could these be? Green prescribing such as gardening, walking programs, blue prescribing such as swimming, coastal activities, arts and creativity such as art therapy, expressive writing, movement-based such as yoga, Nordic walking, peer support such as links to patient-led groups, or community participation, volunteering, and other types of group activities. Again, you will find reference to these in the systematic scoping review we introduced to you earlier on the previous screen. Another very interesting publication and an organization in the UK that we can refer you to if you're interested is the National Academy of Social Prescribing, and I'm going to be talking about this later on with Bradley. But just about this publication, the impact of social prescribing on health service use and costs, points out something else that's very interesting. So it is being already explored within cancer care and long-term support models in relation to healthcare services. Again, they underline that it addresses psychosocial and practical needs beyond treatment itself. It may help extend support beyond clinical settings into everyday life, which is again very important. And some studies suggest possible reductions in healthcare utilization and associated system costs. But evidence in oncology remains limited and implementation models are still evolving. If you want to read about this more, please read the report and we can send you the link later on as well. So what limitations are we aware of when we look at the methodology of social prescribing. And I know, and I already understand that a lot of people in the audience are interested on why we call this prescribing. Is this something that the doctor can prescribe? How does this work? So first of all, let's just summarize what are the kinds of evidence that are missing. So most studies on social prescribing in cancer populations remain small, exploratory, or feasibility based. So as we've seen, there are some studies, but they are limited. And another big challenge is that social prescribing is not consistently defined across studies and healthcare systems, with variations in intervention models, implementation approaches, and what is considered social prescribing. And an example of this is, again, if anyone on this webinar is interested, you can just simply type in social prescribing, NHS England, and you will find their own definition and their own explanation. And you will also see quite an early, so a study that came out 6 years ago on social prescribing and community-based support, a summary guide. So you find all of this on the NHS website if you're interested. So studies are ongoing. The concept is interesting. A lot of people are looking at it. A lot of healthcare systems are looking at it, but still evidence remains limited. We don't have any data on long-term outcomes. The existing evidence is focused mainly on adult populations, very little research, very specifically on adolescents and young adults. And questions remain around referral pathways, which is important. We need to understand how this can be prescribed. How can this work? How can this be linked to healthcare services? Participation barriers, again, very important questions. Unequal access to programs, if there will be or are programs, are they accessible to everyone? And also we want to understand which patient groups may benefit the most. So why does this matter for the MELODIC project? As I told you earlier, we shared a QR code and we can share again with you the website of this project so you can understand more about it. This project contributes to a still underdeveloped area of cancer care research focused on mental health support beyond clinical treatment alone. So again, it's innovative. It explores how community-based and nature-informed interventions may support mental well-being during the first year and the second year after cancer diagnosis. It focuses very specifically on young adults with cancer, a population still underrepresented in social prescribing research. And it examines both patient support needs and healthcare professional training needs. Again, we want to understand how we can support the entire system, not only the patient, but the patient within the system within which a patient is treated and is served. So as a summary, MELODIC combines social prescribing informed approaches. It includes green and blue space activities, psychosocial and information support, and lived experience input from young adults, caregivers, and healthcare professionals. And just very quickly, I want to give credit that a lot of the pictures that we have shown you in this slide deck are in fact taken from the YARN project, where young people with lived cancer experience are participating in some green and blue space and nature-informed physical exercise workshops and activities. So before I'm going to stop my presentation and have a little chat about with Bradley about how this actually works in the UK, I would like to show this video to you.
So as a doctor, I love my job and I know that I can really make a difference to people's lives. But most of health 80% in fact, sits outside medicine. It sits with social connections, with connection to nature, with the diet, being more active, being happy. And that is a job I can't do on my own. That's where social prescribing comes in. That's where the link worker can help open up a new world of health. So green social prescribing is when you refer someone to nature. It can be through gardening, through conservation work, through walking, or things connected to nature, being outdoors, often with other people. Green social prescribing really can change your health. So find out more about social prescribing and the difference it makes.
All right. Well, thank you, everyone. And now that I'm not sharing my screen, I can see that we have 72 participants with us today. Thank you so, so much for your time and attention. Bradley, so lovely to have you with us.
Thank you for having me.
So this is the first time you actually heard this background about the MELODIC project and what we are looking at right now and what we would like to do and achieve. Can you tell me a little bit, maybe your thoughts and where you're coming into this space?
Yes, absolutely. So I come into the space from a lived experience of cancer perspective. I was diagnosed with leukemia when I was 19 and then experienced it again when I was 24 and have been a member of the Youth Cancer Europe community since then, but have done other things here in the UK. And something that I'm very passionate about and committed to is community, and community being used to improve people's mental health, to improve people's emotional well-being, as well as their physical well-being, providing opportunities to them. It's really a hub of innovation, community, when people come together, share their stories, share commonality, and learn about each other. It's something so fundamentally human and very special. So beyond my work in the cancer space, since 2022, I've also been the vice chair of the National Academy for Social Prescribing, which taps into not just my love of community, but also my work within the healthcare system here in the UK, specifically in England. And our mission as an academy is to spread the innovation that is social prescribing. And I think it's such an incredible concept and something that I'm very committed to doing. But I will say, like, there's so much evidence to be shared and there's experts on this call that can speak to the clinical need better than I can. But I find it really interesting. So having served with NASP for so long, we speak about innovation, and social prescribing is innovative, but it's built on something that has existed since we learned how to walk as humans. Social connection and being outside helps your mental health. It's not really groundbreaking. We talk about medical innovations and technologies and everything that are innovations. Like social prescribing in itself is innovative in our approach to it, not just in the UK, but also internationally, across Europe and internationally. But it's built on very fundamental instincts in humans, and it's wonderful that we've actually come a bit full circle.
Exactly. I mean, sometimes we feel it's a bit of a shame, right? Earlier this week I was at The Economist and the World Cancer Forum, and I was wondering about what my input should be. Obviously, the moderator's question was about PROMs and PRAMs, patient-reported outcomes, and should we have more data because it's so important to better understand the patient experience. And the question was, do you think that hospitals would take a quality of life more seriously if there was more data reporting guidelines? And I was like, what are we talking about? There is evidence, for example, let's just take one very, very obvious aspect of good quality of life, mental health. There is so much data. There's been so much research. Can we talk about implementation? And it's the same actually with social prescribing. I think the idea itself that being in nature is good for us is not new. What would be truly innovative if it could be really part of what the healthcare system provides. And this is where, again, we come to that word prescribing. So can you tell me a little bit about the UK? And without studies, you don't need to talk about statistics and things. I mean, obviously, we can share the links and people can look up the reports, for example, in the National Academy of Social Prescribing that we have in the UK. But do you see some good examples where this actually works? And do you see the results? I don't know if this was actually available for you in the clinic where you were treated. I have a feeling it wasn't.
In a village in the middle of nowhere, no. But when I came to London, yes. But therein lies the problem, and that's why I'm really proud of the work that the National Academy does, because we have shown that there are ways to deliver this. Now, it's not delivered, it's a mission, it's a journey to go on, because it's system change and that does take time. But the UK is amongst some incredible countries that are really positioning social prescribing as being part of the overall health offering to its population. And I'm really proud of that. And I think the biggest indicator of the belief in social prescribing, because the National Academy has built up such a huge evidence bank, and that is one of our modus operandi, really, is we were set up to support organizations delivering social prescribing services locally and nationally, helping people access funding and support, helping organizations access that support, funding and training too, building partnerships. But the big one is building and sharing of evidence, both producing it ourselves through primary research, but collating it into an evidence bank. And there's such rich evidence that does exist out there. But the UK is really one of the leaders, because the government itself funded the National Academy of Social Prescribing in 2022, 3.6 million over the course of 5 years. And our grant has just been renewed, which is actually not been announced yet. But I'm not going to say how much.
Great time to do it.
But it really is it's a sign that this has government backing, but not just the government of today. It was in 2022 that the Conservative government, Matt Hancock, the Secretary of State for Social Care and for Secretary of State for Health and Social Care, actually established the National Academy. And then it's been under the guidance of the Department of Health ever since. It really has cross-party consensus. There's MPs on both sides and both chambers. There's experts. There's so many people that can speak to the value of it. And I think that's what's really exciting about social prescribing, is that it's not a hot potato. It's not something that people are wanting to kick the can down the road. There's really been a lot of commitment to delivering it. So all I can say is that there's backing from the government. And when it comes to that, we've started to now see a really ingraining of social prescribing within the healthcare service itself through our social prescribing link workers.
All right. So before we move on, Bradley, just for our listeners today, if you could just put it in a few sentences, like how social prescribing works in a hospital. There's a patient admitted to the hospital, whether, or maybe on day appointments, whatever it is, but somebody got into the system with a cancer diagnosis. How would social prescribing work? Just a very, very practical.
And I think that's the beauty of social prescribing, is it's not bound by the bottleneck of healthcare services, which some are. So you can access a social prescribing service through your GP, primary care, through secondary care, through your nurses, through link workers, through charities. Social prescribing is delivered by the charity sector here in the UK, as well as other voluntary communities. You can access it through online, but you typically ask a healthcare professional, and they will signpost you to a local link worker. They can come to your hospital bed if you are in hospital. You can go to the clinic. You can go to your local charity. I think that's the beauty of what the new system that's starting to manifest, is that it has multiple points of entry. And that inherently makes it more accessible. Because for myself, being treated in a small cottage hospital in a countryside when I was 19, I didn't get that option. That wasn't available to me. But now I'm glad to say that it is. There's a lot of social prescribing activity happening in North Allerton, the town where I'm from. And that's just a sign that there's been a lot of change, even within the 10 years. Social prescribing is reaching out into rural areas as well as being really active in urban centres. And that's what's really exciting. Social prescribing allows you to express your personality, your identity, your interests, in order to make it work best. You have to really expose yourself. You have to be really open and honest for social prescribing to work in the way it was intended. And I think that's what makes it really special as an intervention.
Is the burden still on the patient though to find out? Like there's a lot of trauma at first diagnosis. It's not something that people think about. Social prescribing, anyways, sounds just like a word amongst
And that's it.
the
So,
tens of thousands of words that you first hear in your life when you're first diagnosed.
and that's the big part of it, really, because what young person is going to say to their nurse, "Oh, I'd like to do some social prescribing."
No one.
They're not. What it's about is understanding what falls under the umbrella of social prescribing, and it is a big tent. It's a big
Yes.
umbrella to use that bad analogy. It's about the system. When somebody is saying something, if they're in a hospital bed and they're saying that they feel lonely, or if they're saying that they want to, I don't know, meet some other people through art, if they want to meet some other people through the cinema, if they want to go walking, if they want to go to the gym, if they want to work on their fitness, whatever they're interested in doing, it's the healthcare systems and the healthcare professionals' job to identify, so they're looking for a social prescribing intervention, and then signpost them appropriately. And I think that's the job that we've got to do through training of healthcare professionals, and what we're doing now, talking about it and spreading the word and informing people that actually what you might be doing and providing in your local community is social prescribing.
Actually,
so let's make people more aware of it, because it is a clinical term. I really like the etymology of social prescribing. You are prescribing social activity. It's a health intervention. But we need to tell more people that what is happening on the ground already is social prescribing. In the UK, in a lot of big hospitals, big pediatric centres, UCLH, the Christie, you name it, there's a lot of social prescribing activities happening in there already, but we don't name it. So it's all about the naming, it's the mapping, it's the identifying, and it's allowing the system to point and signpost those who need it to it without having to say the word itself.
Exactly. Well, thank you so much. So lovely to have you as always.
Thank you. It's nice to be here with a different hat on, actually.
Yes, please, if you feel like it, do leave some links for our viewers in the chat, if you don't mind. That would be absolutely lovely.
Of course I will.
And
thank you,
if
Katie.
anyone, thank you as well. And if anyone from the Youth Cancer team would love to, could help with also leaving the MELODIC link, website link in the chat as well, or maybe Youth Cancer Europe link as well, that would be fantastic. And I am very pleased to invite Dr. Saintuya Dashdondog, who is a postdoctoral researcher in Health Promotion Research Center in the School of Health Sciences, in the College of Medicine, Nursing and Health Sciences in the University of Galway in Ireland. So, Saintuya, the floor is yours, and I am going to help you by sharing your presentation.
Thank you, Katie. Here's my name. Very hard to pronounce, but
you're very welcome to say your name if in case I said it wrongly.
It's Saintuya Dashdondog. You said it right.
Okay.
Thank you. Okay, so as Katie has already introduced, the MELODIC project was inspired by the many benefits that social prescribing can bring to mental health and psychosocial well-being, and therefore it adopts the community-driven and social prescribing-inspired approach. So I'm very happy to have the opportunity today to give you a bit more details about this project. Just to let you know about the people behind it, in order to implement the MELODIC project, an international consortium of 14 organizations from 8 countries joined together in a collaborative effort. The partner organizations are in universities, cancer support services, hospitals, patient organizations, and NGOs. So while the project intervention and interviews primarily take place across 6 countries, first 6 countries in this list, the broader research and strategic network spans all 8 countries. So MELODIC project consists of several phases that inform each other. So first, there is a needs assessment, what we need to work on in the project. So the needs assessment was carried out in the first 2 phases, which are the survey among healthcare professionals to determine the current knowledge and educational needs of healthcare professionals in relation to mental health support to young adults with cancer and their caregivers. On the other hand, other part of needs assessment was interviews with the young people with cancer, their caregivers, and healthcare professionals as well, to explore the mental health and psychosocial needs of young adults and their loved ones, and the ways to support them in their experience of cancer. So I would like to note that caregivers in our project, informal caregivers who are family members or loved ones. So the survey results and insights from the interviews informed the next phases of MELODIC project, which are training course for healthcare professionals on early screening for mental health issues in both adults and caregivers, as well as the interventions to support them. And for young adults and their caregivers, we developed an innovative social prescribing-inspired and nature-based intervention to support their mental health and well-being. So I will just briefly talk about these phases in the next slides. So the international online survey among healthcare professionals was conducted with the aim to identify the educational needs of healthcare professionals regarding mental health screening and psychosocial support, and identify priorities for future training. So total 271 healthcare professionals from 21 different European countries completed at least 70% of the survey. Most respondents, 70%, said that they needed training on the use of screening tools for mental health problems, and also training in recognizing early signs of cancer-related mental health problems. And only 30% said they discuss social prescribing options with their patients regularly. Just briefly show you the graph where the healthcare professionals prioritized training and using screening tools. However, there was a lower need for training in specific mental health interventions, such as using social prescribing and physical activity. This was probably because they view this not as interventions, but a part of routine care. And also the cause of this may be that concept of social prescribing is relatively new still. So the overall findings show that it is very important to train the healthcare professionals in screening skills for mental health among healthcare mental health for young adults with cancer, and also their caregivers. So it's very important to because it will help them to identify mental health challenges at an early stage, respond timely, and provide a holistic and integrated support for them. The other part of the needs assessment was interview study that was conducted with the aim to identify mental health needs of young adults with cancer and their family members, and the perspectives how these needs could be addressed. So data analysis is ongoing, but there's wanted to show you some quotes from respondents, and it shows that a lot of scope for improvement in many areas, including mental health support services and low awareness of those supports that exist, and even the awareness of these supports in the broader society. What was interesting that it showed that social contacts seem to be very important to all three groups of respondents. Mental health support for family members was perceived very limited. And in terms of social prescribing, a lot of healthcare professionals were actually unaware of the options they could offer to their patients. So, based on this survey and interview findings, training course for healthcare professionals has been developed and conducted. The first two modules are focused on increasing the healthcare professionals' knowledge of impact of cancer diagnosis on mental health of both young adults and their caregivers, and how to recognize the signs and symptoms of distress early in cancer care. Quotes showed that it's really is a lot of changes needed in terms of how support is delivered in health cancer care services, and also change the perspective of the society as a whole towards the support to mental health care to young adults with cancer. This is the training course. As I said before, first two focused on increasing the knowledge of healthcare professionals on how to recognize early the signs and symptoms of mental health distress in young adults and also their caregivers. And the third module was focused on screening, most commonly used screening tools and the interventions that could help young adults and caregivers to support their mental health, including social prescribing inspired interventions. So the fourth module is dedicated to how an interprofessional collaboration can enhance the cancer care. All modules also included online workshops with participants where the expert would talk to them, answer their questions, and discuss case studies and practice important skills. Okay, so here we come to the MELODIC intervention, which is actually inspired by social prescribing. Next phase that we are about to implement right now, which consists of three components, which are information support sessions, guided group walks in natural environments, and online physical exercises that the participants can do at home watching the pre-recorded videos. But above all of this activities is the main purpose of the whole intervention is the peer support during these activities and opportunities to ask questions from healthcare professionals on the topics that are important to them. And our aim is to create space for our participants where they can interact with each other and with healthcare professionals. So behind these structured activities, what we hope to achieve is something that truly aligns with the social prescribing concept. The sense of community, the sense of belonging, sense of connection to others, and the feeling that they are not alone in this journey with their diagnosis, that they have community that supports them, and their healthcare professionals are there for them to answer any questions, to relieve any fears and uncertainty they may have been experiencing. So this is the very essence of social prescribing concept reflected in our project of community support, which is as powerful as the medical support. So therefore, MELODIC intervention model uses this community-based approaches for mental health support in cancer care, and the evaluation will be carried out, as you can see in the bottom, to see what outcomes it brought, and what is the feasibility of intervention to to integrate it into routine cancer care. So at the moment, we are at the stage of getting ready to start the recruitment of participants. We are planning to carry out the recruitment in summer months. The intervention is planned to start in the beginning of September. Just to briefly show who are our participants we are aiming to recruit. They would be young adults aged 18 to 35 years old, and within 2 years of cancer diagnosis, and also other type of participants would be their caregivers. 4 clusters of participants will be recruited for the intervention based on their age. And in total, we are aiming to recruit 30 participants in each partner country, which is 20 young adults and 10 caregivers. So therefore, we would, taking opportunity to speaking at this webinar, we would be very happy if you or your loved ones would be interested in taking part in the intervention. And if you spread the word among your networks as well about the MELODIC intervention, that would be great. So the anticipated primary outcomes for young adults and their caregivers who participated in the MELODIC intervention include improved mental well-being, specifically in reduction in symptoms of psychological distress, anxiety, and depression. Secondary outcomes that can come from these improvements will focus on enhanced general well-being and quality of life. To see these changes were brought by our interview or not, we are going to use various instruments and measure mental well-being, coping abilities, quality of life, and the levels of peer support and physical activity before and after the intervention. Also, as I mentioned before, we'll evaluate the feasibility of the intervention if it can be successful and could be integrated into the routine cancer care. And just to conclude, we're really hoping that this project, our MELODIC project, will help to understand to healthcare professionals and everyone who, in a broader audience, the importance of mental health support of young adults with cancer and their caregivers. We are hoping that this type of activity can be integrated into standard care of young adults with cancer. For that, this needs to be tailored for young adults' unique needs and interested. So we will find out at the end of the intervention through our post questionnaires if it was acceptable and was appropriate for them, and should be supported by sustainable funding and resources. And to support and promote that, we can increase the awareness of social prescribing to all, and from the general public to healthcare professionals, or the other way around.
Thank you so much. Yeah. Thank you so much, Saintuya. And as everyone sees, the website is also here, and you can go there and find out more information. Thank you so much for everything that you shared. I think one of the things that I think I like the most is that we're not only referring people perhaps diagnosed with cancer or with any other diagnosis with this model to people who are exactly like them, because we do talk a lot about peer support, and Youth Cancer Europe believes in peer support. In many countries, our young people come from communities that are patient organizations. Youth Cancer Europe is a patient organization. In Romania, the Little People Cancer Charity has a very beautiful and large patient organization, Temerari. But social prescribing prescribes activities in neighborhoods and in communities. And I think these are also very important things for us to remember, that these are also important. So peer support with peers like me, but also peer support with others, you know, who might not be exactly like me, but maybe they are interested in the same kind of activities or same hobbies or things like that. And I think it's a very important aspect that maybe we are not, you know, accessing or thinking about often enough. If you don't mind, I'm going to share my screen again just for a minute. And this one is, just trust me, it has something to do with social prescribing. This is actually a group, a commission that the WHO has set up, a WHO commission on social connections. And there is actually a report that you can read. And I'm just going to highlight some of the things that really stood out to me. So if we look at studies and statistics, loneliness affects 1 in 6 people worldwide. And the rates are actually the highest among young people. And especially high among young people in low-income countries. And there's also a very interesting concept on social health. What is social health? So health, and we see a very interesting picture of this, health can be physical well-being, mental well-being, and social well-being. You see my slides, right? You see my picture? Okay, good. So social well-being is also part of health. And it's really important that we start thinking about it like this. It's really important that we also start doing research like this, that we start doing studies like this. And there's also a very interesting point made in this study on social connections, talking about the drivers of social isolation and loneliness, and that's about poor health being one of the very, very big drivers of social isolation and loneliness. So I'm very happy that we have some projects that look at this. If you also want to look at the WHO publications on social prescribing, then here it is. This is the publication to look for. And I think this was all I wanted to share. And now I'm going to invite Ruxi, Dr. Ruxandra Simonescu, if you would like to share the work that you're doing on social connections together with us.
Yes, thank you very, very much, Katie. I closely listened to the discussion, and I believe us as doctors have a lot more to learn about, you know, social prescribing and the social aspect of health, as we have been taught, you know, the traditional paradigm to say so. So it's highly relevant for me to witness to the work that's already been done. I will speak on behalf of Babeș-Bolyai University in Cluj-Napoca, Romania. And first, I would just like to briefly introduce the YARN project that I'm a part of, for those of you who might not be familiar with it. YARN, the European Youth Cancer Network, is a European project involving 28 European countries with beneficiaries and partners from all around Europe, whether we talk about patient organizations, universities, research institutes, healthcare networks, and hospitals. And the overall aim is to improve the quality of life of young people affected by cancer across Europe through a range of activities and research interventions. The study that UBB is coordinating focuses on exploring the role of social connections in the lives of young people affected by cancer. And the idea behind this work is quite simple. We know that social relationships matter. We know that family members, friends, healthcare professionals, peers, and communities can play an important role during treatment and survivorship. However, we still know relatively little about how young people experience these connections, which relationships become particularly important, how these relationships change over time, and how both support and isolation shape the emotional well-being and recovery of young people with lived experience. So our study aims to assess the perceived role of social connections during and after cancer treatment. And we are interested in three things. First, the frequency and the quality of different social connections. We look at support coming from family members, partners, friends, healthcare professionals, peer support groups, religious leaders, other professionals, and also digital sources of support. Second, we want to explore the narratives around social support, but also social isolation that have influenced young people's emotional well-being. And last, to identify patterns that can help us better personalize our strategies in the future. Methodologically, we are using a mixed method approach to this. We are conducting a survey involving 250 young people with lived experience that will be followed by 30 in-depth interviews and 3 focus groups. The survey that you will hopefully help us a bit with your insights is based on the standardized, previously validated scale that has already been used with young people. And participants are asked not only who they turn to for support, but what type of support they received in the moments that they needed it. And for example, we explore emotional support, practical and material assistance, advice and information, physical help with day-to-day activities, and opportunities for companionship and social participation. And social experiences after cancer are often complex. So beyond measuring support, we ask about changes in relationships and communication. We ask whether people felt that the people around them became more distant after a cancer diagnosis, whether they experienced being left out of social activities, whether some relationships became stronger, or whether they experienced a sense of grief over different connections that had changed or disappeared, and other information of this type that would help us understand young people's experience a lot better. What we have done so far in the project was to scan the literature, do a rigorous literature review, develop the questionnaire. Then that was really, really important to have feedback from young people through the youth council, who reviewed our questionnaire and gave us a lot of specific insight. Then the survey now is currently underway until the end of the month. And the next phases will include a qualitative part with the interviews and focus groups, and will conclude with a comprehensive report on the role of social connection in the lives of young people affected by cancer. So without making this longer, I warmly invite you to either complete this questionnaire if you are a young person with lived experience, or to help us share it in your networks, and help us generate evidence and recommendations that will be a lot more personalized to the needs of our target group. Thank you very, very much.
Thank you as well, Ruxi. So these are the things that we are looking at and we are hoping to study when looking at social connections and young people with cancer. I don't know if maybe my colleague Anna, if you can just bring all of us speakers onto the, I don't know, stage. I don't know how you say it on a webinar, so that we can see each other. Just change the view, as I cannot for some reason. But thank you so much, everyone, for your participation. Some people asked if we will be sharing the video. We will be. We will edit out some bits and we will share with you the video. We are very pleased to share with you the presentations as well. I see that Bradley has left a lot of links in the chat. You're very welcome to copy them out now and to click on them. And good luck for everyone. I see that some people, Umu mentioned that they will be doing actually a study on loneliness and its associated factors. Good luck with that. I also saw some other comments on what might be some challenges to making social prescribing a reality in a hospital setting, in a clinical setting. But we hope that all of this is going to be actually changing soon in Europe. And that the MELODIC project will contribute to it, and everyone's efforts will be contributing to it as well. The project is still going to go on for a few years. Next year, we will be inviting Saintuya back to tell us what will be the results of those interventions in the MELODIC project. I think we will also be very happy to see Ruxandra again and to hear about the results of the social connections study in the YARN project. And maybe we'll hear from Bradley or from anybody else in Europe who can actually give us some insights to how social prescribing might already be a practice in their hospital, in their institution. So thank you so much, everyone, for taking your time this evening to spend it with us and to listen to this webinar. And we hope to see you soon again. Thank you so much.
Thank you,
Goodbye, everyone. Thank you.